Wisp Sports Radio, the voice of women in sport.
This is Season 1, Episode 5 of Active Health. Thank you for downloading this podcast and welcome to Active Health. I'm Dr. Juliet McGrattan, and this show is about the health niggles and issues that can affect exercise or even prevent you from doing it altogether. I'll be giving you tips and information on how to overcome these niggles from my experience as a doctor and a runner. In this episode, I'll be talking about side stitches. Stitches can quite literally stop you in your tracks. It's very hard to ignore that dull, sometimes stabbing, crampy pain, which takes your breath away. And it hurts even more every time your foot hits the ground. And it honestly sometimes feels as severe as you'd expect a pain that required a surgical intervention to feel. That horrible feeling going right through your body every time your foot hits the ground. So what actually is a stitch? Why do some people get them more than others? How can you prevent a stitch? And most importantly, once you've got one, what can you do to get rid of it? So thinking first and diving straight in about what actually is a stitch. And the honest answer is, we don't really know. There are many things in medicine that we don't know, and this is one of them. There are lots of theories. Some of these theories are worth thinking about. They include a lack of blood supply to the diaphragm, which makes the diaphragm muscle cramp up. Another theory is that the movement of the internal organs as you're jogging or jolting up and down causes a tugging on the ligaments and tissues, and that tugging causes the crampy pain. Another theory is that actually the pain comes from the spine and it's a nerve pain being referred round and felt in the front of the abdomen. And again, another theory, those internal organs jolting around, causing friction and irritation of the lining of the abdominal cavity, and many more theories besides. And, a lot of more research and work needs to be done to figure out what the exact cause is, why some people get them more than others, and why they're more frequent in some types of sport too. They seem to be higher in sports such as running and horse riding, and lower in cycling, for example. And that fits well with the theory of the organs jiggling up and down being an important factor in the cause. I read an interesting article in Sports Medicine in January 2015, and I'll put the link in the show notes because it does go into this a little bit more and looking at the frequency of stitches in different types of exercise as well. So how can you prevent them? Well, when you don't know the cause of something, it's actually hard to work out exactly how to prevent it. But there are some steps you can take to try to reduce the likelihood of you getting a stitch when you exercise. Many of these are through anecdotes and proven, tried and tested rather than actual research in itself. First thing to think about, obvious one, is digestion. You've got to allow enough time for your food to be fully digested before you exercise. Now, this varies person to person. As a guide, you need at least 2 hours after a full meal. Some people need to leave 3 or 4. Everybody's different, but allowing the time for the digestion to have happened will reduce the likelihood of you getting a stitch. Secondly, make sure that you are well hydrated. We think that this might reduce the likelihood in some people. You don't want to overdo it and drink masses just before you go because then you just feel bloated. So it's better just to sip frequently in the hours before you exercise rather than simply downing a pint of water just before you head out of the door. And some people have said that high sugary drinks such as fruit juice can be a trigger as well. An important way to reduce the stitches is actually to warm up well. Ease yourself into vigorous exercise more gradually, and that can sometimes help to prevent you getting a stitch. Another cause or another way to try to prevent them is actually just to be patient. Stitches are much more common in those people who are just starting their fitness journeys, and they can really put people off. But, don't let them, because as you get fitter, you'll find they generally happen less often. You start to understand your body more and you understand about your digestion and your hydration and your warming up. But actually, the increasing fitness can make a big difference. And anecdotally for myself, I used to get loads of stitches when I first started running. And as time went on and my fitness increased, I get very few stitches now, unless I'm really pushing myself or I've had a great big bowl of porridge literally as I've headed out of the door. Another thought, strengthening your core. There's a theory really that actually if you can have strong supportive abdominal muscles and back muscles in your core, that will help you maintain a good posture. If you can maintain a good posture when you're upright with your lungs plenty of room to expand, then that potentially could help to reduce stitches as well. So all those simple things, digestion, hydration, warming up, gradually increasing your fitness and being patient, and strengthening your core are some things that you can think about and work on to reduce likelihood of getting a stitch if you're somebody that gets them a lot. So you're running along, cycling along, etc. How can you get rid of it? Well, the pain can sometimes be so bad that it just makes you literally want to stop. And although they actually feel really bad, they're not serious. Keeping going isn't going to do you any harm. Nothing's going to suddenly explode inside, even though it might feel like there's a lot of pressure building up. So, what can you do? Well, again, these are tried and tested things rather than evidence, but try these techniques and see if they help to reduce and ease your stitch. First of all, slow down. Keep going, but just reduce your pace. Take the pressure off a little bit, and that in itself can be enough to let a stitch resolve. And then when it eases, you can crank the pace up again when you're feeling more comfortable. Secondly, relax and breathe. Focus on your breathing. Slow it down. Inhale deeply right into your belly and exhale fully too. And finding a regular rhythmic breathing pattern can help to get rid of that stitch. That will probably go along with you slowing down a little bit as well. But those two things together, eventually the stitch will pass. And they usually do pass. They're not usually something that will carry on for the entire race. Stretch your abdomen. So try putting your hands on your head as you're going along, tilting your body to the side. So the area that your stitch is in is literally stretched out. And you can do this while you're on the move. Yes, you can look a bit strange if you're bobbing along with your hands on your head, but who cares? If it helps to ease the stitch, that's fine. It might be that you do want to stop. And if you do, good tip is to touch your toes. Stop. Bend forward just for a few moments, take a few deep breaths in this position. You can also try pressing and massaging gently with your hand actually over the area where the stitch is. You may find when you start up again, if you start gradually and then gradually crank up the pace, that actually the stitch has gone away. If you're running, then there are people, and I've read this and I've tried it a few times myself, and I'm not sure, but it's worth having a go at. If you're running, then people claim that they can get rid of a stitch by slowing down and exhaling as the foot on the opposite side of the body from the stitch hits the ground. So if the stitch is under your right rib cage, as your left foot hits the ground, you exhale. Then you inhale with your right foot, exhale with your left foot. I don't know, but it's something that has been recommended by lots of people. So I guess you just have to try it for yourself and see. It may be that simply it's just regulating and getting more of a rhythmic breathing pattern that helps, rather than necessarily with which foot strike it's on. But you need to experiment and see. So you can see there are so many unknowns, things to try, but not actually a lot of hard evidence. I'm wondering how many stitches you will get, what works for you. It would be great if you could share your tips with us.
Conversations from the world of women's sports. This is Wisp Sports Radio.
You can join in the conversation and follow us on social media at Wisp Sports, or you can follow me personally at Juliet McGrattan on Twitter and Instagram, and at Dr. Juliet McGrattan on Facebook. We'd love to hear your thoughts on this topic, and we'd also like to hear your ideas for future podcasts, and you can email info@wispsports.com. We would be very grateful for your feedback. So, That's the side stitches for today, and thinking about the next podcast, I'm going to be looking at exercising while you're unwell. If you've got a bit of a virus, should you head out of the door? Is it a good thing to do? Will you get better more quickly? Could it potentially be harmful? We're going to be exploring that in the next podcast. So in the meantime, thank you for listening and supporting women in sport everywhere.